Dr. Emily Hattwick. I'm a pediatric upper extremity surgeon. I am also the medical director at Pediatric Specialists of Virginia, where I work with 8 other pediatric orthopedic surgeons taking care of children and all their orthopedic needs. So I vacillated for a while as a young professional, thought I was going to be a marine biologist for a little bit, and then realized that I wanted to have a larger impact on the world than just the marine animals. Then I chose neuroscience and worked with research animals for a while and decided that really I am much more a people person. I love interacting with people and I get a lot of enjoyment and fulfillment out of helping. And so I started medical school with that directive. And while I went through my training, every encounter I had with the hand and the way that the hand helps us live our lives really showed me how meaningful it is to help people who are having troubles using their hand. And as I moved through orthopedics, that just was cemented further along. There's an intrinsic amount of creative work in hand surgery, a lot of problem solving and creative problem solving, matching the problem to the person's needs, and I really like that multidimensional element of hand. I think that there are many voices in healthcare, and there are similarly many different kinds of people who need help in medicine. And having a diversity of voices and people in healthcare is critical. Patients need to be able to listen, understand, implement instructions, relate to their providers, and trust them. And having a woman's voice and perspective in that process is critical. 50% of our patients are girls and women, and significant numbers of family caregivers are women, and they relate well to similar experiences and patterns of care. And so having women in medicine is critical. There are many, many memories that I have, some of which are just simply interactions with my young patients who, after working with them for a period of weeks, say at the end of a visit, I want to be a doctor one day. And I feel so grateful to have had a piece of that decision or that impact that made them choose a career in helping other people. But one of the memorable events in the past 10 years that I would share is I am a part of a Women in Medicine and the subgrouping of women in orthopedic surgery, and have been asked a few times to speak at the annual meeting for that. And each time I go to that meeting, which is attended by orthopedic surgery residents, by medical students, and sometimes by high school students, everybody asks, how can you be a mother and a surgeon? As if that's an insurmountable barrier, which unfortunately perseverates over time. Even over the 20 years that I've been a surgeon, it seems like it's still very present. And so I always engage the medical students, college kids, high school kids, talking about how having a work-life balance is important no matter what you do. Being a mother does not restrict or limit you from your career choices. You just need to be thoughtful in how you structure your life. And absolutely, you can be a mother and a surgeon. There is nothing that should tell you that you can't, and don't listen to anybody. And for me, those interactions with these young professional and pre-professional women, giving them that opening the door that says you can do what you want to do and you don't have to give that up in order to be a parent, in order to have a family, in order just to have a life separate from being a surgeon. There is a way to find that balance, and don't give it up fast because someone tells you you can't.